importance of recognizing skin cancer symptoms and also just protecting your skin in general is Dr. Anthony Rossi. He is a dermatological, a little bit of a tongue twister, surgeon at Memorial Sloan Kettering. Good morning, doctor. So good to have you here. Just in general, as we've been saying, it's been a coldish winter. So now we have the sun beaming again. Before we get into some specifics, what's your general guidance kind of to our viewers this morning?
Good morning. Yeah. So I think sun protection, we always think about it in the summer months or when we're leading up to summer, but it's actually a daily practice, right? We just need to get into the routine of using regular SPF in our daily morning routine just to start the day, but especially, of course, during the summer months when the UV index is quite high.
Yeah. And doctor, obviously we go to the beach, we sit by the pool. So talk to us about protecting ourselves from the sun. You don't want to sit directly out. Those umbrellas, they do help. So give us some general tips and advice. We want to enjoy the sun, but at the same time, we want to be protected by it.
Of course. So I always tell my patients, you just need to be sun smart or sun safe. It's not about like completely, being in the shade 24/7. It's about protecting yourself. So using a broad spectrum SPF that protects both against UVA and UVB. Also wearing sun protective hats, sunglasses to protect your eyes, and even those sun shirts or sun bathing suits that have SPF weave built in and SPF factor in there. Those are great too, especially for kids who don't always reapply sunscreen as they should.
Talk to us more about reapplying, because I understand that is really the key, not just the SPF factor, doctor, right? Because, the factor doesn't mean much unless you reapply it.
Yeah, of course. So we want to get a sunscreen that has an SPF of 30 or above. So SPF is the protection factor against UVB. So looking for a 30 or above is great, but you should also look for broad spectrum. That means it's going to cover UVA as well. And UVA rays can also penetrate through clouds or even window glass. So even on a cloudy day, you can still get exposed to UVA. And of course, putting a good base coat on before you go outside. So at least 30 minutes before you go outside is really great. And then the reapplication is very important. So when these are tested and to get that SPF measure and the UVA protection factor, you really are reapplying every 2 hours. And I know that could be difficult for a lot of people. So we tell them, just keep a constant reminder, especially if it's really sunny, they should be reapplying every 2 hours.
And let's talk about some of those symptoms, right? Stuff to look out for on your skin if you see it. And we have some of those on the screen that we could bring up as well. Spots that look or feel different from others, uneven borders, something to look out for. Talk to us a little bit more about what our viewers should keep in mind as they kind of do their own self-examinations on their skin.
Yeah, I think it's hugely important not only to get checked by a board-certified dermatologist, but also to check yourself and your loved ones, your partners, regularly. So you're always looking out for new or changing lesions. Those are very key, right? So if you see something new or if you see something changing, that's a big tip off. There's also the ABCDEs of melanoma that we sometimes use with patients. So A is asymmetry, if it's not a perfect circle or it's irregular in certain areas. B, if the border is jagged or crooked or broken. C, if there's color change or there's multiple colors in the lesion. So if it's black or red or changing colors, that's really important. D, if its diameter is bigger than a pencil eraser, which is about 6 millimeters. And E, which is a really important one, goes back to if it's evolving or changing over time. That's really a strong factor. And those are the main ones for melanoma. But there's also non-melanoma skin cancers like basal cell and squamous cell carcinoma. And those can be pink or red. Sometimes they can be brown. They can be very flaky. They can be itchy or painful. So all of those are the warning factors for skin cancer.
And doctor, talk to us about some of the new advancements in technology in terms of diagnosing skin cancer, treating it, and in some ways also preventing it.
Yeah, so the beauty is that dermatology is really coming up with new ways to help not only diagnose early skin cancers, but also we have many different tools to help actually prevent it as well, which is amazing. The main one of prevention is, of course, sun protection, right? So we just talked about that. Yeah. But at our hospital, we're also using AI imaging. So using really fancy cameras to take 3D body images of really high-risk patients. So people who have many different moles or a history of many skin cancers or multiple melanomas. So we can really track them going forward, and we can track their whole body and see if any lesions are changing or growing over time. There's also, we're training the computer or AI algorithms to actually recognize worrisome lesions, like looking for a melanoma in a sea of many different moles. So the technology is rapidly expanding.
Yeah. Well, a lot of good tips. And of course, a very important reminder, especially on this holiday weekend. Dr. Anthony Rossi, good to talk to you. Thanks again for coming on.
Thank you, doctor.
Thanks so much.